I am Melinda Fontaine. I am the clinic director of the Pelvic Health and Rehabilitation Center in Walnut Creek, California. Today, in honor of May being Pelvic Pain Awareness Month, I'm going to speak to you about interstitial cystitis as part of our Pelvic Pain Explained webinar series. In the 1800s, interstitial cystitis was identified as an inflammatory disease of the bladder. That is the literal meaning of what interstitial cystitis means. In the 1900s, Guy Hunter was able to look inside the bladder with a cystoscopy and identified lesions in the bladder lining. And these were termed Hunter's ulcers. In 1978, Messing and Stamey did a study and found at Stanford, they found that the majority of patients with IC do not have Hunter's ulcers. In fact, fewer than 10% of patients with interstitial cystitis actually have Hunter's lesions in their bladder. And because of this, I think has spurred a change in our terminology from interstitial cystitis, which means an inflammation of the bladder, to now talking about painful bladder syndrome, which is what a lot of people still use interstitial cystitis to talk about, but it's a more accurate description of it because it simply includes all different situations in which there's uncomfortable bladders, basically. In 2011, the American Neurological Association published the first guidelines on interstitial cystitis and painful bladder syndrome, and then in 2014, they revised them. These guidelines are still not in practice in every single medical practice in the United States, but we need to make that happen, so that's looking good. The current definition for IC is an unpleasant sensation, such as pain, pressure, or discomfort, perceived to be related to the urinary bladder. Notice perceived. It's associated with lower urinary tract symptoms of more than 6 weeks in duration in the absence of infection or other identifiable causes. To make the diagnosis of interstitial cystitis or painful bladder syndrome, a doctor would need to examine your history carefully, do a physical examination of the body, and run some laboratory exams to rule in all of the characteristics of IC and rule out other disorders such as urinary tract infection or other things. The doctor would then get also baseline voiding symptoms and pain levels in order to be able to compare how different treatments are affecting a patient. And this is an interesting part that a cystoscopy, or where they look inside the bladder, or urodynamics, is not necessary for making the diagnosis in every case. It can be used as an aid in complex presentations, but it is not necessary, which it used to be considered the gold standard. So the first line of treatments in this recommendation are general relaxation and stress management, pain management techniques, patient education, self-care and behavior modification. These are kind of more thinking about the whole body, holistic interventions. They're not associated with the bladder itself, notice. So because oftentimes the bladder is not the cause of these symptoms, but merely where patients experience their symptoms, the first line of treatment is not usually directed at the bladder itself. One of the things that is recommended is paying attention to what's being put in the bladder. So this is a good way patients can learn to take care of themselves. These are all lists of bladder irritants. And one that surprises people is dehydration, especially in patients who have a symptom of having to go to the bathroom frequently. They have a tendency to want to limit the amount of fluids they take in, to limit the amount of trips they have to make to the bathroom. But actually, that's causing their urine to be more concentrated because they're dehydrated. And concentrated urine is more irritating to the bladder. The bladder is going to want to get rid of it quicker, and you're going to have to go to the bathroom more frequently. So let's make a more dilute urine by making sure that we pay attention to how much water we're drinking and we get plenty of water in our bodies. Other irritants include things that tend to be acidic in nature. So that's tomatoes. Carbonation is also irritating. Citrus, chocolate, food colorings, artificial sweeteners, spicy foods, vinegar, alcohol, coffee, and caffeine. Not every person with IC is bothered by these bladder irritants or by all of them. Sometimes it's just some. Sometimes a person can eat any of these things and it doesn't bother their bladder. And that's okay because everybody's different, and it might have something to do with the different presentations and the different causes for the same situation that we're calling interstitial cystitis. The research shows that 87% of people diagnosed with interstitial cystitis or painful bladder syndrome have pelvic floor hypertonus, which is the muscles of the pelvic floor are two types. The pelvic floor muscles, we learned about in a previous webinar, sit underneath the bladder, and they can contribute to symptoms that people with IC complain of often. Having to pee frequently or urgently, having pain when they pee, having pain in their bladder, pain in their urethra. And it can be, it's correlated with pelvic floor increased tone. Also, we know that the peripheral and central nervous system are hypersensitive in a lot of people with interstitial cystitis. We also know that hormonal factors, changes in hormones, perhaps estrogen, testosterone, and different hormones, can cause tissue changes that feel like bladder pain. That can be very confusing for some people too. And dysfunction in the musculoskeletal system can mimic urologic dysfunction. So what this means is basically your body can create something that feels exactly like a problem with, for example, a urinary tract infection. But it's not caused by an infection. It's actually caused by the muscles and the fascia around that area. So I hinted earlier about the different subtypes of interstitial cystitis, and they're basically organized by what's causing the pain. So we have 5 main subtypes that were identified. The first one involves Hunner's lesions, and sometimes this is referred to as classic IC. Or some people refer to this as IC and the other 4 situations as painful bladder syndrome. So you might see that terminology. But like I mentioned before, this is 10% of the population of patients with interstitial cystitis have Hunner's lesions. These are inflammatory lesions. You can see them on the inside of the bladder wall. And they would require treatment specific to the bladder lesions. The phenotype of the bladder wall is when there's usually an initial insult to the bladder. It could be a urinary tract infection. It could be an exposure to certain chemicals such as chemotherapy. It could be a lot of consistent dehydration and things that are irritating to the bladder over and over again. And these patients typically find if they were to do an installation of like a lidocaine in their bladder that would numb the bladder lining, that it would feel relieving to them. The treatments usually involve things that are going to let the bladder wall heal itself. So it could be modifying your diet to avoid trigger foods that are irritating to the bladder, some over-the-counter things that are very soothing to the bladder, some medications, and different bladder-directed therapies. The third one is myofascial pain phenotype. So myofascial means muscles and fascia, the connective tissue that goes around your muscles and around every group of muscles and around your whole entire body, like you're wearing a spandex suit. It's everywhere. In this situation, the cause of the pain is usually because of muscle tension or restrictions in that fascia that I was describing a second ago. It could be trigger points. Some people refer to those as knots. Like if you get somebody rubs your shoulders and you feel a knot in the area. Trigger points can be in any muscle in the body. And so it could happen in your pelvis and around your bladder, and it could be creating bladder symptoms as well. So it could be in the pelvis, the abdomen, could be in the back, the hips, the legs, anywhere, but it's that the muscles and the fascia are the cause of the pain. And this treatment responds very well to pelvic floor physical therapy, which is directed at those muscles and tissues. The fourth kind is neuralgia. This phenotype, neuralgia means pain in the territory of a nerve. And so in this type, there's something irritating the nerve. And it could be one of many things. For example, it could be a tight muscle, which is pushing or pulling a nerve. Nerves don't like to be irritated. They like to be able to move freely, to slide and glide. If anything prevents them from doing that, they will cause different sensations, and one of the sensations could be pain. It's typically a burning, stinging, electrical type of pain when it comes from a nerve. And this type of interstitial cystitis would respond better to more nerve-directed therapies. And we will see in a later webinar post, Stephanie's going to talk to us about neuralgia in general, and a lot of the explanations are very similar to what's happening here. And the last phenotype is multiple pain disorders or central sensitization. A lot of these patients will present with, as the name states, multiple pain disorders. So things that go along with interstitial cystitis, we often see in irritable bowel syndrome. We see small intestine bacterial overgrowth, vulvodynia, fibromyalgia, and other pain syndromes. Central sensitization refers to the fact that in this population, we often see the central nervous system is overreacting to a stimulus. So especially when it's been going on for a decent amount of time, the body will create more nerve endings in an area so that it can get more information, and it will put more sensitive nerve endings there. So think about that car parked in the parking lot and you just walk by it and look at it funny and the alarm goes off. That's what the body's doing. Something totally normal stimulus. It might be a full bladder, for example, or sitting on a chair, should feel a certain way, but the body is taking so much information in and it's perceiving it as a threat. And so it's actually going to create a painful experience for that person. And that's the central sensitization. And that's going to require a different kind of treatment as well. So the second line treatments recommended by the American Neurological Association are more based on which phenotype patients fit into. So they're more individualized to which set of symptoms somebody's presenting with, what the cause is. So you'll notice that as we go through this list here. The first recommendation is manual physical therapy techniques. A number of the types we just went over include tight muscles and fascia, and that can be very helpful to address that first. So pelvic floor physical therapy is a number one treatment recommendation. Other things that can go along with physical therapy or in place of, if physical therapy is not appropriate, if there's no dysfunction in the muscles and the fascia, it's not necessary. But a lot of people will benefit from physical therapy in combination with some oral medications, such as amitriptyline and these other ones. They might benefit from bladder installations if they also have bladder irritation. Commonly, people will put DMSO or lidocaine in the bladder and see if that helps break that pain spasm cycle. And pain management, which often includes a lot of education about pain, understanding what's happening in a person's body, breaking down so they know what to do when they're in pain. They know, how scared to be of it, how to treat it. All of the pain management stuff that can be done with a physical therapist as well, and probably should be done by all of the team members taking care of a patient, the doctor and the physical therapist and the cognitive behavioral therapist and everybody who's involved. Some research has been done to show how physical therapy can help patients with interstitial cystitis and painful bladder syndrome. So this study was done in 2009 and 2012. There was research conducted from people at Stanford, Michigan, Cleveland Clinic, UPenn, and other programs. And they found that nearly 90% of patients with interstitial cystitis experienced at least some improvement with manual physical therapy. And significant improvements in pain, urinary symptoms, and sexual dysfunction were all reported over the course of 10 one-hour sessions. They followed up this information with some more research published at the International Pelvic Pain Society that found that 65%, more than a 65% improvement in patients' IC pain and how much their symptoms bothered them on a daily basis. And more than half of the patients noticed that they experienced benefits within the first 3 treatment sessions, which is very quick. So PT does a number of things for patients. One thing is it releases the trigger points I mentioned earlier. So where the muscles, it can be very tight, it can alleviate the tightness, and it can eliminate the trigger points. It can clear inflammation. It can restore blood flow to the area, which is very important. The blood flow brings in all the nutrients your body needs to heal. It also takes out all of the debris your body has made at the cellular level, including inflammatory factors. So it gets rid of that as well. And it can reduce irritation to nerves. How we were describing earlier that muscles can irritate nerves when they can pinch them or pull them, kind of make them have less space than they want. If PT can reduce the tightness in the muscles and the fascia, then nerves have a better environment to live in, makes them much happier, they can get better blood flow, and they feel a whole lot better. So here's my tips for people with interstitial cystitis or painful bladder syndrome. Number one, stay hydrated. We talked about how dehydration can irritate the bladder. So here's the simple thing to do is to just make sure you're staying hydrated. Number two is try physical therapy. We talked about how it can help a lot of people. And if you think that you might have any dysfunction, a physical therapist will be able to identify that with you, and it may be helpful. It can also be a great adjunct to whatever else you and your doctor are kind of working at. Also, don't get caught up in the diagnosis. So I see a lot of people who have been diagnosed with interstitial cystitis, and they'll go on the internet and read lots of things about it. And today we talked about the confusing part about it is not every person is the same. There's all these different types. So not any one treatment is going to work the same for two different people. No one's experience is going to be the same as somebody else's experience. So just work with your team of healthcare professionals that you have instead of worrying about what a diagnosis of interstitial cystitis means, because it's going to mean something different for you than from anybody else. And think holistically. So we noticed that the first line treatments recommended by the AUA involve mindfulness, meditation, wellness, self-care, all of these things, taking care of yourself. It's not directed at the bladder, which is where you might feel your symptoms. So think about that too, as it's easy to get caught up on focusing on how do I fix the pain right where it's located, but it's a whole body situation that's actually creating these sensations. So to get more information on this, these are some of the resources that I like. The Interstitial Cystitis Solution book by Nicole Kosian is very helpful. There's also an Interstitial Cystitis Association website that's very useful, and the IC Network website. You can also listen on the Bustle about pelvic floor physical therapy and interstitial cystitis, and the Women's Pelvic Health podcast. And you can listen to some professionals, experts in the topic there. You can also read a bunch of stories about interstitial cystitis and painful bladder syndrome at our blog at pelvicpainrehab.com. I would encourage you to do so. I have a couple of questions from from patients. So one is from Kathy in Sacramento. She says, I've heard that cranberry is good for bladder health. Do you recommend cranberry supplements for IC? And simply, I would say no. On that list of bladder irritants, it wasn't printed that I showed earlier, but cranberry is actually a bladder irritant. So that would be a myth that you should use cranberry for IC. There are a couple of other over-the-counter supplements that might be soothing to the bladder instead of cranberry, such as aloe vera. There's another one named Pre-Leaf. They form basically a coating on the inside of your bladder, and they can be very soothing to people. And I would recommend that instead of a cranberry. Another question is, how can you tell the difference between interstitial cystitis flare and a urinary tract infection? And the answer to that one is also complicated because it is very hard to tell the difference. The only way to know for sure would be to do a urine culture with your doctor. And that's because the body can, as I said before, mimic exactly what's going on with the urinary tract infection, even if there's no infection. The muscles, the fascia, the body, it all remembers what to do. It knows what to do. It can create the exact same symptoms. So a flare of IC and a urinary tract infection can present exactly the same way. So I always encourage people to go test it out, do a urine culture and see what happens, what comes of it. Thank you for those questions. So I hope that this was a little bit informative for you today. I also would encourage you to check out Pelvic Pain Explained, our book. It's very helpful as well. And you can go to our website and scroll to the bottom of the page and fill out this form for a chance to win a copy of our book, and we will notify you by email when you win. And I encourage you to stay connected to us as well. Here is our blog again, our Facebook, Instagram, and Twitter, my Instagram and my Twitter. And I thank you for spending time with me today, and I hope that you are looking forward to the last 2 parts of our webinar series. On our blog tomorrow, in case you need help finding this, tomorrow my blog will be posted with all of the resources that I mentioned today. Thank you.